everyone, it's Naya, your everyday XLHer. In this video, I want to talk a little bit about symptoms in children with XLH. Like I said in previous videos, it's 1 in every 20,000 person. Anyway, but some of the symptoms that are noticeable is obviously when you do blood work, whether you go through an endocrinologist or a nephrologist. Those are the two most common areas that will diagnose your XLH. Besides the low phosphorus level, some common symptoms that occur in children are, I guess the three areas are bones, teeth, and muscles. And since we lose our phosphate through our urine, we would obviously have the low phosphate levels, as well as curving or bowing of the legs. It usually occurs when you're about 2 years old. Once you become weight bearing, it's more noticeable that you'll notice like the bowing in your legs and the curving, as well as in some cases you'll get the knock knees, just as an effect of the bowing. And that's one of the most common symptoms, is obviously the bowed legs. And I guess basically whatever is a weight-bearing bone, like if we walked on our arms, I'm pretty sure that our arms would be bowed. It's just whatever bones that we use are commonly affected. And in turn, it also affects our muscles, as well as we will tend to have like delayed growth, and we tend to be short. There is actually hypophosphatemia dwarfism, in which it's not necessarily like the common dwarfism that you may see in everyday. It's actually a form of hypophosphatemia dwarfism. It has its own category because we are taller than the average little person, but we are still considered below average height. So it's kind of like our own classification. And with that, of course, there's the bone and joint pain. And another thing that can occur, not in everybody, but most likely, is the irregularities in the shape of our head, and in some cases causing craniostenosis, in which our skull doesn't form correctly, and it will cause headaches. And another thing is Chiari malformation, in which our spinal cavity is compromised, causing a lot of headaches. I know that I suffer from headaches and migraines, and I was never diagnosed with craniostenosis or the Chiari malformation. But if you go to your doctor, I'm sure that they will tell you right away if you or your child will have anything of that sort. And because XLH affects our muscles, affects our bones, it will also affect our muscles, and to where like some of the common things are like muscle stiffness, muscle weakness, and pain. And because our muscles are on overload trying to work with our tiny little bones in our legs and everything, it is very common for our muscles to tear or be overused, causing like muscle spasms and just different things that affect the muscles, because our muscles are working overtime to try to compensate for our little legs. And with that, it affects like our gait and our like we waddle. So those are the most like common symptoms in children, along with like teeth problems. For example, my sister is 14. She has 2 sets of canines, as well as she is missing 11 of her adult teeth, and most of the teeth that she does have, about half of them have come in backwards. So that's something that she will have to do and deal with as she becomes an adult. And I was always told that we could never or should never use braces on our teeth because we lack the enamel. And with that, braces could cause our teeth to like just fall apart and decay, and we can end up losing teeth that are healthy enough to stay in our mouths. But I know with me as a child, I suffered a lot of abscesses. I lost my 4 front teeth when I was about 8, just because they became infected. I went for a while without some of my teeth. Through adolescence and as an adult, I have had a total of 7 root canals. If you can see, these teeth right here, these 3 have caps on them, and I have a couple other ones that I've had root canals and have caps on them too. So it does cause a lot of dental problems. But in my next video, I will be talking about symptoms that continue through adulthood. And if you have any suggestions or want me to talk about anything specific with XLH, please comment on my Facebook, Instagram, YouTube, and I will be happy to address any of them. And thank you for watching again. Bye.